Transfusion, blood, or blood components. The physician transfuses blood or blood components to a patient. The physician establishes venous access with a needle and catheter and transfuses the blood products. Push transfusion, blood, 2 years or younger. The physician performs a push transfusion on a child 2 years old and under. The physician calculates the amount of blood to be transfused and slowly injects it into the patient using a needle or existing catheter. Exchange transfusion, blood, newborn. Other than newborn, the physician performs an exchange transfusion on a newborn. The physician calculates the blood volume to be transfused. A needle is placed in an artery or in an existing arterial catheter. The patient's blood is removed and replaced simultaneously to maintain blood pressure. Report 36,455 if the child is other than a newborn. Partial exchange transfusion, blood, plasma, or crystalloid necessitating the skill of a physician or other qualified healthcare professional, newborn. Transfusion, intrauterine, fetal. The physician performs a blood transfusion to a fetus. The physician uses separately reportable ultrasound guidance to locate the umbilical vein. A needle is directed through the abdominal wall into the amniotic cavity. The umbilical vein is pierced and fetal blood is exchanged with transfused blood. The needle is withdrawn and the fetus is observed under separately reportable ultrasound. Tenodesis is a surgical procedure that is typically used to treat injuries to the biceps tendon in the shoulder. These injuries may occur due to tendinitis, an inflammation or irritation of a tendon, or from overuse or a trauma to the shoulder area. Biceps tenodesis is a surgical procedure used to treat biceps tendinitis, which is also known as a biceps tendon tear. Tenodesis versus tenotomy. Biceps tenodesis involves cutting the biceps tendon off the labrum, which is the pad of cartilage inside the glenoid, and reattaching it to the humerus, upper arm bone. Biceps tenotomy means cutting off one tendon and not reattaching it, allowing it to heal to the humerus over a few weeks. Tenodesis of biceps tendon at elbow. The patient is placed supine. The physician makes an anterior lateral incision on the lower upper arm, extending transversely across the antecubital fossa. The torn biceps tendon is identified and the tear is minimally debrided. 2 Bonnell sutures are placed in the torn end. A second incision is made over the dorsal aspect of the proximal forearm to expose the radial tuberosity. The physician uses a high-speed burr to evacuate a 5 mm to 7 mm defect in the radial tuberosity. Three holes are drilled through this window to the opposite side of the tuberosity. The physician places sutures through the holes and places the tendon into the window in the tuberosity. The sutures are pulled tight and secured. The incisions are repaired in layers with drains inserted. The elbow is placed in a splint in 90 degrees of flexion and full supination. Tenodesis of long tendon of biceps. The remaining stump of the tendon can be removed by a motorized shaver. A simultaneous subacromial decompression may be performed. Debridement of the frayed portion of the tendon may be performed. Tenodesis at wrist, flexors of fingers, extensors of fingers. A window is made in the anterior surface of the distal radius proximal to the wrist. A similar second window is made more proximally. A crisscross type of suture is passed through all four flexor digitorum profundi tendons side by side. The tendons are transected proximal to this suture. The tendons are drawn into the more distal window in the radius, through the medullary canal, out the proximal window, and sutured back to themselves. The tension on the tenodecies is adjusted. All open soft tissues are sutured in layers. The wrist is immobilized with the metacarpophalangeal joints flexed and the interphalangeal joints extended. Tenodecies, of proximal interphalangeal joint, each joint. Of distal interphalangeal joint, each joint. The physician incises the overlying skin and dissects to the joint. The tendon is incised and sutured over the joint space, providing joint stabilization. Capsulodesis, metacarpophalangeal joint, single digit. 2 digits. 3 or 4 digits. The physician incises the overlying the skin and dissects to the MP joint. The capsule of the joint is sutured to the proximal and distal bones to stabilize the joint. The incision is sutured in layers.